they will start to show the tar-looking stains in their fingers, either between the two fingers here, as they hold the cigarettes, and as you see it in the slide. It can also, the tar stains and nicotine stains can be seen also in the nails, where it will have the brownish color in the nails, and these are all nicotine stains that indicates that your patient that you are examining is a smoker. Whether he's telling you that or he's not telling, you can discover these signs easily in the hands of the patient. We go through the hand examination, and the next thing that we look at will be looking for finger clubbing. The finger clubbing, actually that can be seen in some patients. There are different causes of them. Is a very important sign because it can tell you whether your patient is sick, and then you start to have the list of causes of clubbing so that you can point out to a cause. But before you remember the list and you start telling, it is important to know how you can carefully look at the fingers of your patient to find clubbing or no clubbing. There are three important signs that can indicate whether your patient has finger clubbing or not. The flat angle, this is the list, softness at the nail bed, and the drumstick appearance. And I will start one by one in the other slides. The flat angle and how you discover them. Actually, you look at the angle between the nail and the nail bed, okay, which is an angle that, as you see it in the slide, that is usually is not flat. You will see an angle normally in normal people. It will not be beyond 180 degrees. It should be less in normal people. However, when you start to see flat angle and the angle is almost 180 degrees, this is a sign of flat angle. The best way at looking at the angle will be from the profile, and actually you come down and look at patient hands rather than you raise the patient hands, because to keep your patient comfortable, that you start to come down and look whether the angle is preserved or not. Remember that your patient has a lot of fingers and has two hands. So it's not enough to look at one hand and one finger and say no clubbing or even clubbing. You have to look carefully, and you have to look at both hands and look at more than one finger in both hands. And this will make sure that there is flat angle or no flat angle. Okay, so we're still at the flat angle, and then this is another slide just to tell you how do you see flat angle or not. The slide indicates the normal, the early clubbing, and late clubbing that you can see in your patient. The flat angle issue also include what we call as the Schomburg sign, and this is important to know how to perform it, and it is important when you are not sure about the angle, whether it is preserved or it is flat, or when you have disagreement between you and another colleague, then you use this sign, and this sign actually will tell you whether the angle is totally flat or the angle is preserved. And the way of doing it is, as seen in the slide here, is that you will have two fingers, and probably we'll apply it to our patient. سوي يدك كده، أيوة، لا كده finger. Okay, and you start to look at the angle between the two fingers. As expected, if the angle is not flat and still preserved, you will you will still see what we call as a diamond shape between the two fingers, as a diamond shape space between the two fingers. If the angle is lost and the two fingers are having clubbing, then the diamond-shaped space will be lost, and you will see the angle totally flat, and you cannot see the diamond-shaped space, empty space between the two angles. So this is, okay, خلاص. Remember, whenever you ask your patient to do something, you have to show him how to do it properly, and once you finish, you ask him to relax, not to continue doing the same thing for a long time. So your instructions to the patient is very important to be clear, and you ask the patient to do what you need, and once you finish that, you ask your patient to rest. Okay, so I finished doing this sign, and here the actually diamond-shaped space is still preserved, so my patient here does not have flat angle, and he's still not showing the signs of clubbing. Another sign of clubbing that you should always look at also, that you start to feel, the actually nail bed of the patient, which is the part of the finger that is above the nail, just above the nail, and you start to feel it, okay? And in patients who are normal, this place will be firm and is not spongy. Those who started to have clubbing, they will start to have softness at the nail bed, spongy feeling, and some books even call it fluctuation, although I don't like the term fluctuation because usually it points out to fluid. This is not fluid. So you just feel it as seen in the slide there, and you can see the way that video shows how to feel for the softness at the nail bed. And if the patient started to have clubbing, the nail bed will be soft and spongy. So this is the second sign. The third sign that can appear with advanced clubbing is the drumstick appearance of the fingers. Again, look at all fingers, both hands. The drumstick appearance will be as shown in the slide here, that the tip of the finger will be more prominent, and it will look like a drumstick at the tip. Okay, this is usually a third-degree clubbing, which means advanced clubbing, and this is actually also indicate the clubbing. If you see one sign, it's 1-degree clubbing. If you see two signs, 2-degree clubbing. And if you see all the signs and the drumstick appearance, this is advanced clubbing or third-degree clubbing. So you can, by this way of careful examination, you can tell whether your patient has finger clubbing or not. Once you finish that, then you go next to looking for wasting at the hands, okay, muscle wasting, and can be seen muscle wasting in the hands of the patient by looking at the thinner and hypothinner muscles. And if the patient started to be wasted, the thinner muscle will look as flat. In normal people, the muscles will be bulky, okay, as you see also in my hands, will be bulky. And if the patient starts to have wasting hands or wasted hands, he will start to show flattening of this bulk, as you see it in the slide, and that indicates clubbing in the hands. The same slide here also shows that you can look at the dorsum of the hand, and you can see the interossei. The interossei muscles are the ones that we see between the tendons, and if there is wasting, you can see that the tendons will appear more prominent and you can see them. And if there is no wasting, you will not be able to see that. And the slide indicates here the wasted hands and the unwasted hand. So if you find this wasting, then you comment on it in case you can tell that there is wasted hand, or that you discovered that the hands of the patient are wasted. Still we are at the hands. And at this stage, probably the last point in the hand examination is we look for what we call as flapping tremor or asterixis. And these are jerky movements of the outstretched hand that the patient will show. And it is important to recognize whether your patient has flapping tremor or asterixis or not. There are a lot of causes of tremor, but in respiratory system, there are respiratory failure of type 2 that can show with a sign of flapping tremor. So it is important to look at whether your patient has flapping tremor or not. And what we do usually to look for that, we ask the patient to outstretch his hands at the elbow here. كمان هذه أيوة. And then we ask him also to keep his hands like this up and actually separate his fingers like this. And then we just wait to see whether our patient has tremor or not. Some patients, they will start to show that as flapping tremor, and it is shown in the slide here in this video clip that I put on the slides, that the flapping tremor will appear, and you can see that it will be. So some patients may not show it immediately right away, and you may have actually to evoke that and make it appearing. And the way to do that is you hold the hand from here and push the hands. So you hold the forearm, and push the hands backwards and release it. And in patients where there is flapping tremor, you'll start to see the tremor now more prominent. Because some patients may hold their hands and start to keep the flapping tremor away. But this maneuver will not let them do that, and you can actually make it clearly appearing. So before you say there is no flapping tremor, you better to do this maneuver, and better to do it also at both hands. And again, wait for seconds to see whether you start to see the flapping tremor. And always the hand has, or the arm has to be kept outstretched from the elbow so that the patient will show if he has flapping tremor. Our volunteer here does not have flapping tremor, but this videotape that we are seeing in the slide is showing that. So always support your patient as you go through, because he will start to be exhausted. So speak to him, telling him that things will be over soon, so that you can carry on with the examination of your patients. The second or the next step here that I recommend is to go to vital signs now. After we finish the general appearance, the hands, we go to vital signs, and we check pulse, blood pressure, respiratory rate, temperature, and pulse oximetry. Pulse oximetry nowadays is considered very important and to be added to vital signs. However, the list of vital signs, the technique, the maneuvers of listing the vital signs will be given to you in a separate session of vital signs. So I will not go through these details, but it is actually an important step to do before you go further.